This is CGTN, China Global Television Network.
More testing underway as Africa coronavirus cases reach 800, according to Africa CDC. Globally, the number of US coronavirus cases tops 14,000 as Europe looks to extend lockdowns. And more good news from China as new infections on the Chinese mainland continue to slow down. Hello and welcome to CGTN. This is Africa Live and I'm Karen Roberts in Nairobi. Also coming up in the programme. In business, Kenyan flower farms lose 40% of sales as global demand shrinks. And in sports, the South African Football Association postpones all games over the coronavirus pandemic. In Africa, 36 countries across the continent have reported over 800 cases of COVID-19. Let's now take a look at the numbers by region. Northern Africa has the highest number of confirmed cases. Egypt has so far registered 256 infections of the respiratory disease from a previous count of 210. The government said that during the flight ban and schools shut down, hotels and all educational facilities will be sanitized. Algeria now has 90 cases of the coronavirus, mostly in the Belida area, south of the capital. President Abdelmajid Tebboune earlier this week ordered an end to street protests. Meanwhile, Morocco has 61 confirmed cases of COVID-19. The government has closed all mosques, schools and entertainment venues and has banned all international passenger flights. In Western Africa, Senegal has the highest number of infections. Niger, on the other hand, has announced its index case. The patient, a 36-year-old Niger citizen, had recently travelled to Togo, Ghana, Cote d'Ivoire and Burkina Faso. In Eastern Africa, a seventh COVID-19 case was discovered in Ethiopia. The patient is an Australian citizen who travelled from Geneva, arriving in Ethiopia on Monday. In Central Africa, Chad has confirmed its first case of the coronavirus, a Moroccan national who had travelled to the country from Cameroon. Numbers are also increasing in Southern Africa. South Africa has recorded over 50 more cases in the country, bringing the total number to 202. Overall, the World Health Organization is reporting 17 deaths and 48 recoveries on the continent. Well, as the number of confirmed COVID-19 cases increases in South Africa, more internal transmissions are being reported by local health authorities. CGTN's Angelo Coppola tells us more.
The number of internal transmissions of COVID-19 positive cases is increasing. That's when people get infected and aren't connected to infected people who've travelled to high-risk countries. It's concerning, especially for township dwellers and the poor.
Well, there's two things that's going to happen. In the absence of a vaccine, there's going to be an even more rapid spread, especially among poorer communities. How do we deal with it? So our government's response, and it's not completely public, right, has been towards airports, for example. It hasn't been tailored to communities, those far out, those far away, and those very poor. Now that's where the response has to be.
The government hasn't done much about community programs so far. It's now becoming critical that this starts to happen.
So, I mean, if you think about a community, right, or the stages that we need to go through, the one is prevention. We're trying by all means to prevent it. It's unlikely we're going to. That's the honest reality, right? The next stage is containing the spread. Will we be able to? Will our health systems be able to? And they won't. The third one is the community response. So government and community response coming together. Now that's where it could be powerful. So already we're seeing worldwide there's responses like trying to get communities to have grocery packages. Now those are the sort of interventions that we're going to need.
High-density living conditions in so-called townships are a huge risk area that needs to be dealt with.
It's complex. I think we're far away from tackling that. We don't have health systems or responses in those communities. Like I said, there's something powerful in community responses themselves, right? So communities starting to come together. We're going to have to think of packages of interventions for people who are affected. That's where the response needs to be. Communities themselves need to think about how they practice social distancing. Is there stigma and discrimination? In the religious spaces, we are seeing some traction. And then very interesting, in Africa, the first point of call for healthcare is traditional practitioners. And what's their role in all of this?
Now, for many in the so-called townships, hospitals like this one are nowhere near where they live. And that's where the general problem is going to arise, because people aren't practicing social distancing and there are no health facilities around. I'm Angelo Coppola for CGTN in Johannesburg, South Africa.
Meanwhile, in South Africa, the government has set strict new regulations to prevent price increases during the coronavirus pandemic. Companies are not allowed to hike prices or profit margins for some sanitary products and foodstuff. Prices for private medical services relating to the testing, prevention and treatment of the virus will also be covered by the new regulations. Suppliers are required to equally distribute goods to consumers, including small businesses, while maintaining adequate stock. Those who don't follow the new regulations will face hefty fines or 10% of the firm's turnover and imprisonment for up to 12 months. Public officials in Nigeria have been banned from official foreign travel. This is one of the resolutions reached by a newly constituted presidential task force set up to control the spread of the coronavirus. CGTN's Kelechi Emekalam has more.
The formal inauguration of a 14-member team led by the Secretary to the federal government, Boss Mustafa. Among other things, the task force is responsible for strengthening national response strategy, collaborating with key players, and laying the foundation for scientific and medical research to address all emerging infectious diseases. And rising from its inaugural meeting, the committee places an embargo on international trips for all public officials. And that is followed by strong travel advisory for citizens.
It has become necessary to advise all public officials in the ministries, departments and agencies, including parastatals, that government has banned all forms of travels out of the country for whatever reason, whether for meetings, bilateral, multilateral, conferences, seminars, workshops, presentations, negotiations, and any form of other ceremonies. This ban will remain in place until further notice and until the situation of the pandemic nature of the coronavirus abates.
For now, all who travel and return to Nigeria will be on self-isolation for no less than 2 weeks. They'll be under strict monitoring by health officials within the period. The committee says it will scale up all emergency response to curb the further spread of the disease.
With regards to the general public, we want to advise strongly that citizens, in their own interests, should cancel or postpone all non-essential travel abroad, including business and vacation trips. This is especially so, especially when it comes to travels to countries known to be seriously affected by COVID-19. And such high-risk countries are China, Iran, South Korea, Germany, Italy, USA, UK, Switzerland, Norway, Netherlands, Spain, France, and Japan.
The committee says it would scale up all emergency response to curb further spread of the disease, and it's been given a 6-month timeline to execute its tasks. Kelechi Emekalam, CGTN Abuja, Nigeria.
Meanwhile, in Zambia, the 21st batch of a Chinese medical team joined a live education program on 5FM radio station. Dr. Ma Chao, who led the Chinese medics, helped Zambians to better understand COVID-19 and ways to deal with the threat. The Ministry of Health in Zambia has so far reported 2 confirmed cases of coronavirus in the country. The Chinese medical team hope that through a series of education programs, Zambians will improve their preventative measures against infections. The world has seen a dramatic increase in confirmed COVID-19 cases, with the total death toll surpassing 10,000. Across the globe, more than 244,000 people have been infected. Outside China, there are over 160,000 cases spread over 150 countries. Italy has the largest outbreak in Europe, confirming over 5,300 new cases on Friday, with over 3,400 deaths. Spain is Europe's second most affected country, reporting over 18,000 infections. Iran, the worst hit country in the Middle East, has over 18,000 infections. The United States has seen over 6,000 new cases, taking the total to over 14,000. South Korea has more than 8,600 cases, with the death toll approaching 100. New infections on the Chinese mainland continue to slow, but it now faces a wave of imported cases. All of its 45 new confirmed cases are imported. Hubei province has reported no new cases, and 87% of patients in China have recovered. Italy has reached a grim milestone, becoming the country with the most COVID-19 deaths. More than 3,400 people have died. Italian healthcare workers are warning their counterparts about the grave situation they too could face soon. Alex Fraser reports from Milan.
Italy now has the highest number of deaths from COVID-19 after figures released by the Italian government this evening confirmed it's now passed the death toll even in China. To put this into perspective, based on population size, China's population size is 20 times that of Italy. Lombardy, the region at the centre of this epidemic, is facing a major public health emergency. Bergamo, a city in Lombardy, has the most cases in Europe. After many deaths, coffins are unable to be buried, and they've been building up in graveyards. Today, the army were brought in to move the coffins. In this part of Italy, there are many towns where everybody has a story of somebody they know being infected. This is a country that relies so much on face-to-face contact, large families, and as a result, the spread of this virus has been devastating. A plane of 12 Chinese doctors arrived at Milan's Malpensa airport yesterday, bringing with them 17 tons of medical equipment, including 400,000 masks. Lombardy is currently the region most infected by the virus in Italy. After meeting with the Chinese delegation today, the president of the Lombardy region, Attilio Fontana, said that the Chinese doctors were amazed by the number of people still out travelling on public transport and out on the street. They've suggested that the public transport, which is still running, should be stopped and all non-essential production work with it. The governor said that he will speak to the Italian Prime Minister to see if stricter measures can in fact be imposed after those conversations they had today. Earlier today, in an interview with Corriere della Sera, Prime Minister Giuseppe Conte said that containment from the lockdown is working, but it will have to continue past the end date of the original decree, and that was supposed to be at the end of March, but that's going to continue, and restaurants, bars and shops, with the exception of supermarkets and pharmacies, have all been closed since last Wednesday. Alex Fraser for CGTN in Milan.
Earlier, we spoke to Dr. Valerio Mogini, the head of public health for the Italian Red Cross. He told us about the situation in Italian hospitals and why the death rate there is so high.
The most affected area in Italy are the northern Italy, and so the this is also the part of the country who is suffering the most. In Bergamo area, in Lombardia and Emilia-Romagna and Veneto, hospitals are trying to increase the activities for COVID patients. It means that many unnecessary services or services that can be delayed have been cut from the hospitals, and all the resources, human resources and equipment have been used and is being used for coronavirus response. Obviously, all the emergency care and oncological care and for patients without COVID-19 are also guaranteed to the population. Many hospitals have created new intensive care unit beds, and doctors have been hired from the whole country and asked to go where it is needed. At the same time, in the whole country, the hospital system is rearranging itself, and it's trying to define where COVID patients can be treated if we have a surge also in this area, in that areas. So far, medical equipment is still needed, but the government has placed orders all across the world, and doctors have been asked to go in the most affected areas in order to treat all the patients. As far as the mortality rate in Italy is concerned, we do not have an explanation for this high mortality rate, but it's probably due to the fact that we are just testing people who access the hospital and they have symptoms, and we are not testing the general population. So probably if we started testing the general population, the mortality rate would drop.
The number of confirmed cases in the UK has now surpassed 3,200. But Prime Minister Boris Johnson says the country can turn the tide on the pandemic in 12 weeks if the public follows government advice. CGTN's Andrew Wilson reports now from London.
Another day of adjustment for UK families as they prepare for Friday, the last day of schooling, and all the implications that brings with it.
It is disruptive, to parents, especially like, for example, my partner, she works in healthcare, so she has to go into work despite, the shutdowns.
We've ordered a trampoline and we're hunkering down for the long haul, I think.
40 underground stations have been closed in London to limit public travel, but also, it's thought, ahead of more excessive measures in the capital to come. More families at home, more concerns about the simple daily tasks of exercise and shopping.
My last ditch to try and get some shopping until we all have to go into lockdown.
At a Westminster meeting, the Chief Medical Officer has confirmed his belief that the mortality rate of COVID-19 is around 1%. And at his regular press briefing, the Prime Minister could only offer reassurance and drive home existing advice.
Work from home if you possibly can. Wash your hands. And it's by this combination of ruthless, determined, collective action and scientific progress that we're already seeing that we will succeed.
The government says it's moving forward with the science, and it's clarified 3 priorities. The public must observe continued social distancing at all costs. The health service must be allowed to keep preparing more hospital beds suitable for intensive care treatment. And that as testing is rolled out further, it must be used not only for intensive care staff and patients, but also hospital workers, so they know when they can work and when they can't. But the warning to the public was the loudest.
To be clear, even if everybody does all the things we hope and really would ask that they do, the numbers will continue to go up over the next 2 weeks because it takes a while for there to be a lag.
Concerns that the government might shut down the capital, London, did not materialise. Indeed, the implication was that if the public plays its part and the science keeps up, the government can turn this round in 12 weeks. It's not a certainty, but it is optimism. Andrew Wilson, CGTN, London.
In France, the number of coronavirus cases has reached over 10,000, with the new infections surging by about 1,800 in the space of 24 hours. And the country's healthcare system is under growing pressure. Our correspondent, Ross Cullen, has more.
A pandemic is really going to stretch the services of every country's health facilities, but we have seen there's been some concern amongst those facilities, particularly in this area. So the two hotspots are around Paris and in the capital itself, and also in the Grand Est in the east of the country, along the German border, such as the areas around Strasbourg. And we have had people being moved from those medical facilities, flown down south to other hospitals with more capacity, because the hospitals and the healthcare facilities in the east are overwhelmed as well. And there's been support coming. We have had deliveries of masks as well from countries such as China. The army has said it's going to deliver more masks as well. It's going to help with the delivery of those to places that need them. And we have had more support coming from the president, saying that those healthcare workers, he's going to make sure there is extra hotel beds, more taxis available for those that need them to get to and from hotels as they really try to find a place to rest their head. There has been support from the government because the pressures now being applied on the healthcare structure and on the healthcare staff are unprecedented, and that's why France has been taking unprecedented measures, such as this lockdown, as the number of those who have tested positive, now more than 9,000, and the number of people who have lost their lives, now more than 200. That number, those data continue to rise.
The number of coronavirus cases has reached over 14,000 in the US, with the new cases surging by about 5,000 within 24 hours. California's governor has issued a statewide order for people to stay at home while President Donald Trump tries to put a positive spin on the situation. CGTN's Nathan King has more.
With the number of cases and deaths accelerating in the US President Donald Trump Thursday focused attention on possible future treatments and cures for the virus, which are, let's face it, months away at best. Masks and ventilators are still in short supply. Trump chose to be positive in the face of the unknown.
We'll be back, and I actually think we'll be back stronger than ever before, because we learned a lot during this period of time.
A dose of reality followed, however. The US president hosted a video conference with governors of this nation's embattled states. They called for more federal help, leadership, testing and equipment. The White House says some states must take the priority over others, and it has nothing to do with politics.
Still, over 50% of the cases come from 3 states. This is why we continue to prioritize testing in those states.
Underlying the global nature of this crisis, the US State Department issued a level 4 travel advisory, the highest, essentially telling Americans not to travel and those abroad to come home if they can. And work continues on an unprecedented $1 trillion economic stimulus package. Europe may be the epicenter of this pandemic right now, but fears are the US could be the next center. The White House is insisting that the nation is ready. The rest of the nation isn't so sure. Nathan King, CGTN, at the White House.
We are going to a short break. Don't go away. Lots more to come, including Uganda launches study on improvement of refugee financing in the country. And Ethiopia scales up aerial spraying of pests.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
On the Horn of Africa, with around 5 million people, lies the enigmatic country of Eritrea. how has the small multicultural nation dominated the continent of African cycling? And produced the first black African cyclists to finish the mighty Tour de France.
Lawmakers in Cote d'Ivoire have overwhelmingly voted to revise the country's constitution. Lawmakers met for a session this week in Yamoussoukro. 246 lawmakers voted for the country to adopt a new constitution, while 2 voted against. The new planned revision of the constitution will not include an age limit for presidential candidates, and this has been worrying for the opposition. President Alassane Ouattara vowed late last year that he would not seek a third term in office.
The vote of parliamentarians for the revision of the constitution produced the following results. 246 parliamentarians voted in favor of the constitution revision and 2 voted against. It is, therefore, the place to thank the President of the Republic, Alassane Ouattara, for his vision and clear-sightedness, which aims at inscribing our institution in sustainability and modernity.
I am very pleased and very proud of all the parliamentarians because we have just done something useful for the Ivory Coast. We have just laid the foundations of peace and serenity for a better tomorrow in Cote d'Ivoire.
In Uganda, authorities have launched a study on the finances of refugees in the country. The project aims to improve efficiency in the payment of humanitarian support and to provide relevant formal financial services to refugees across the country. CGTN's Michael Beleke has that report.
Uganda is host to more than 1.4 million refugees. Most of them live in 28 settlements spread across the country, having fled conflict in South Sudan and the Democratic Republic of Congo. But most of them don't have access to basic finance.
Of the 1.4 million refugees, about 300 are professionals. We have teachers, we have nurses, we have pilots, we have professors, we have business people. And as a matter of fact, some of the refugees that we have in this country have very big business empires.
Bidi in northeastern Uganda is one of the largest refugee settlements with a population of close to 300,000. Only 13% of the refugees here have access to financial services. A new study looks at ways to remove barriers that deny refugees access to money.
The purpose is to be able to understand the lifestyle and the behavior of refugees so that the products that are produced are specific to their lifestyle and be able to build them so that we can not only give them access but they'll be able to use them.
Refugee policies in Uganda allow migrants the right to education, work, private property, health care and other basic social services.
7% of the total refugee population in Uganda lives in urban areas like this Kampala suburb. They struggle to earn a living. The government believes empowering them financially will help meet their needs in a safe and sustainable manner, contribute to the economy and cut down on aid dependency.
The suggested interventions include offering loans to support small businesses that could stimulate economic activity and increase take-home incomes for refugees. Commercial banks and microfinance institutions would facilitate the process.
Historically, they've been receiving food through partners like World Food Programme and UNHCR providing maize and beans and so on and so forth. But the current shift is towards cash-based interventions. That means we must find a way to get cash or money in some form into the refugee settlements.
Refugees largely depend on mobile money services, but under the project, refugees will be trained as agents to provide financial services in the settlements on behalf of banks. The goal is to improve the socio-economic freedom of refugees by putting money directly into their hands. Michael Balekes, GTN, Kampala, Uganda.
The UN Food and Agriculture Organization has warned that the desert locust invasion in the Horn of Africa is still creating widespread destruction. FAO has been helping the Ethiopian government scale up aerial spraying, targeting the insects. The organization says the situation is especially serious in Ethiopia, Somalia and Kenya, where a new breeding cycle is in progress. CGTN's Cote Wanjoy reports now from Addis Ababa.
This is one of the spraying aircrafts that the UN Food and Agriculture Organization has leased to assist Ethiopia in aerial spraying of locusts, along with helicopters. The organization says that the swarms are tough to control and are doing major damage to crops.
It is difficult because it's affecting livelihood of the people. The intensity is very high, the spread is very large. So this is something that Ethiopia has not seen over the past 25 years. Kenya have not seen it over the past 70 years. Yet we are prepared. As you have seen also, we have the experts from FAO. FAO is sending experts to the country. The countries have their own experts, and we must seriously upscale all the operation to minimize the losses and to control this crisis. It can be done, but we need the resources to do it.
The aircraft can fly over 4 hours, carrying 1,500 liters of insecticide, with the ability to cover 1,500 hectares. Ethiopia, whose southern region is now a breeding ground for locusts, says it needs at least 8 aircrafts to get the situation under control.
In the east, it was not with the same degree that it was before. I mean, it used to come and go. I mean, it was not a big deal to control it in the beginning. But this time, it was not only in the east. It was moving. Maybe this could be associated with the direction of the wind, maybe associated with climate change. You can name it so many things. But it is not very familiar, like you said, to see it in the west or even in the central part of the country. Even if it happens previously, it just come and go. It disappears. It has never lasted. It's going to for a year now since it came to Ethiopia. So now we are still expecting somewhere by the time we are talking here, maybe it is hatching somewhere else. So we are expecting some in some places again to appear.
In addition to aerial and ground spraying using technical people, the country is now training local communities on how to combat the insects.
This needs a coordinated action from the local people, and we need to also train people even not to combat, to identify the breeding place. So if we attack in the breeding place, that is the simplest way of attacking locust actually.
The Food and Agriculture Organization says the swarms are now under control in Sudan, Eritrea, Egypt, Saudi Arabia and Oman. The organization has made an emergency appeal for over $130 million to assist the 9 countries affected by the invasion. So far, it has got over $50 million. It hopes more donors will respond quickly to save crop production in the affected countries. Coletta Njohi, CGTN, Addis Ababa, Ethiopia.
We've got all the business news coming up for you after the break, including Kenyan flower farms lose 40% sales as global demand shrinks. And a relief for consumers as Nigeria reduces petrol prices.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Africa Live. Find your voice.
In Kenya, flower firms have shed a fifth of their casual workforce and sent a similar number on compulsory leave. The industry is struggling to survive the aftershocks of the coronavirus lockdown. Cancellation of overseas orders and travel restrictions in affected countries has hit the industry hard. The sector is experiencing an estimated 40% plunge in sales. This has forced firms to turn on their 150,000 workforce to save their companies from outright losses. The Kenya Flour Council has warned that the headcount could drop to 20,000 in the next few weeks. Kenya's earnings from horticulture exports, including flowers, fruits and vegetables, fell 7% in 2019 to $1.35 billion from $1.46 billion. This is mainly due to lower prices of flowers at the auction in the Netherlands. In Nigeria, the government has reduced the pump price of a litre of petrol from 145 naira to 130 naira, which is around 35 US cents. It says the decision follows a huge drop in global oil prices. Nigeria imports most of the fuel it consumes domestically, and any changes in global oil prices affect the prices at home. CGTN's Deji Badmus has that story.
For many Nigerians, this is some good news at a time when there isn't much to cheer about the Nigerian economy. With the continued spread of COVID-19, international crude oil prices have slumped to below $30 per barrel. This has triggered fears of a possible economic recession in Nigeria, where earnings from oil exports power the economy. The government has now decided Nigerians should pay less for petrol.
As a result of the COVID-19 pandemic, you are all aware that oil prices have drastically dropped. And we know that this really will translate to a lot of sufferings on the part of Nigerians. Therefore, the President has graciously approved that the pump price of petrol should also accordingly drop. So the pump price of petrol will be from now 125 for now. If there is any further drop, it will even drop further.
On the streets, people have welcomed the news. However, not all the filling stations in the country have complied with the new price directive.
So now you can use 1,000 and buy food that can take you to a distance and come back. So it's a good development. We love it so much.
I was happy. I was jumping up, hoping that by now I'll be buying it at a lower rate. But I just bought the fuel now. It's still the same.
You know, the marketers, the problem with them is if the price goes up, they will change it immediately. If it comes down, they will not adjust it. They are telling us that it's a old price, is blah, blah. So they are not selling like that now.
Nigeria spends hundreds of millions of dollars every year on petrol subsidies. The subsidies estimate for this year is over $2 billion. But the drastic drop in global crude oil prices has literally wiped that off, which is why the government chose to slash the price of petrol at the pump.
This is a golden opportunity for federal government to completely remove fuel subsidy. Nigeria spends over ₦1 trillion annually on fuel subsidy, and I'm not surprised that government is saying it's reducing 2020 budget by approximately 1.5 trillion per day, an amount that is equivalent to what we would have spent on subsidy.
Petrol subsidy is more of a political issue in Nigeria than an economic one. No government has been able to muster the political will to end it. And despite the current price reduction, it's very unlikely this government will go all the way to remove it completely. But while the public enjoys the new price regime, it should be ready for an upward review once the global price of crude begins to go up. Deji Badmus, CGTN, Lagos, Nigeria.
The Tunisian government has ordered the closure of all cafes, bars and restaurants by 4 p.m. on a daily basis. The new measure aimed at stopping the spread of the coronavirus is being implemented nationwide with the help of security forces. And as CGTN's Adnan Shawashi reports, some businesses have been forced to shut down while others are sending employees home.
Ziad invested all his savings in this cafe located in Bardo city near the Tunisian parliament. He usually works for 17 hours a day to pay his rent, as well as the expensive electricity and water bills. Just like tens of thousands of people in this sector, Ziad is now forced to limit his working hours from 6 a.m. to 4 p.m. over COVID-19.
I understand that the curfew and the early closure are necessary measures to stop the coronavirus, but I can't afford to shut because if I don't work, I can't feed my family. Life's already too hard, but we have no choice but to comply with these measures.
Jamel is a 60-year-old waiter who also complains about the recent decisions of the Tunisian authorities.
The state wants us to stay at home, but it's not willing to compensate the loss. We are losing more clients and money every day. If this situation lasts more than 2 weeks, this cafe will run bankrupt and I'll lose my job.
Many clients, especially young people, have shown increase in awareness since the coronavirus outbreak in the country.
It's difficult to change one's habit. I usually go to the cafe in the evening. Now I'll stay at home. It's hard for bars, cafes and eateries, but this is how we can contribute to the national effort against the virus.
Ziad and Jamel are closing the cafe at 4 p.m. while they have collected less than 70% of the usual daily income. The two men are aware that running a cafe will no longer be easy as long as the coronavirus pandemic is not under control by the sanitary authorities. Experts estimate that over 200,000 people could lose their jobs in the next few weeks. The government's decisions over coronavirus led to the loss of millions of dinars. Every day, cafe and bar owners and managers face an uncertain future with the spread of COVID-19 in the North African country. Adnan Shawishi, CGTN, Tunis.
COVID-19 has had a devastating effect on travel, the financial markets and more recently on the energy sector. The response in the oil market has been significant. Just last week, the oil-producing countries of the OPEC cartel called for a deep cut in production of 1.5 million barrels per day to support prices that are flagging due to the spread of the virus. It led to a split in the cartel and a collapse in the price of crude oil. Angelo Coppola spoke to Nje Ayuk, Executive Chair of the African Energy Chamber.
How deeply has the coronavirus affected the global oil markets?
It's really hit the oil industry. I would say, for example, worldwide, we're going to see more than $1 trillion drop in the entire oil and gas sector, whether with transactions, with projects that are being delayed, or whether it's when it comes to crude sales and everything. I mean, the African continent, for example, we're already seeing about $62 billion that's going to be lost because of this virus. But that's just when it comes to crude sales. There's going to be a lot more when it comes to services. And so it's really taking a big hit on the entire oil sector.
How has OPEC's decision affected the flow of oil onto the continent?
So, for example, I just came back from Nigeria, and the general manager of the NNPC, that's the national oil company, was telling me they have about 35 cargoes unsold right now. So you cannot even sell outside, you cannot sell within, because after the OPEC decisions, the Saudis flooded the oil market with a lot of oil. They unleash a lot of oil in the market, so what happens? Now they even place discounts on the price. So African oil right now is actually more expensive because you're buying crude right now -7, and that is really having an impact on African crude sales and also even African LNG sales, because don't forget, China is a big importer of these products. And if China is not importing, or if China even gets a chance to buy it at a cheaper price, Africa is also still going to suffer.
Based on your experience, when do you think we're going to see this glut dissipate, or when are we going to see things normalize again?
Right now, there's a lot of geopolitics involved, but I think it's going to be short-term pain, but we will come out of this strong, because we're going to see some long-term gain coming out of this. So my prediction would be before the June OPEC meetings, we should see the market rebounding. We should see a solution going forward on OPEC Plus. And don't forget, it's not about getting prices to become very high or getting very low, because uncertainty is not good for the market. What we need right now is stability, and the markets will be stable by the June OPEC meetings.
South African Wamkele Mene has been sworn in as the first Secretary General of the African Continental Free Trade Area. Many was elected in February this year for the top job, beating 3 contenders. He was the former head of mission to the World Trade Organization for South Africa. The new Secretary General will be operating from Ghana, where the organization's headquarters is based. He pledged to speed up the process of making the bloc operational.
Priority should be to rapidly conclude Phase 1 and Phase 2 of the negotiations of the AfCFTA in order to unlock Africa's full productive capacity. The second challenge to the global economy is the ongoing crisis, the coronavirus scourge, which has ravaged global economic activity, has a materially adverse impact on global capital markets, severely disrupted trade and global supply chains, and of course, has had a very negative effect on global public health. Africa should not despair and fall into despondency. From a trade perspective, we should see this crisis as an opportunity. Through the AfCFTA, we have an opportunity to reconfigure our supply chains, to reduce reliance on others, and to expedite the establishment of regional value chains that will boost intra-Africa trade.
We are going to a short break now. Don't go away. Lots more to come, including South African exhibition explores contemporary society and culture.
Join us in Global Business and see Africa through our eyes. The greatest journeys, the greatest sights, the greatest adventures.
Here in Kote, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
To bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
To South Africa, where an architectural exhibition has been held. The exhibition sought to find the relationship between contemporary society and culture, as CGTN's Yolisa Njamela reports.
This exhibition represents a critical engagement with time by browsing through historical acquisitions from Stellenbosch University and the University of Cote.
The vault examines the significance of those acquisitions as fragments of the past and how a museum vault can be a campus for the future.
The exhibition not only aims to move people, but also to transcend the past and map a new future for two universities that once stood at opposing ends during South Africa's segregated past.
So this is more looking at the past, and other spaces are looking at the future and also the present. From the vault, we're not so much focusing on the past, but we're looking at narratives and histories that have been silenced within these, during the acquisition of these collections.
Mashika says it further exhumes archives and engages with museum collections as a critical resource in contextualizing and mapping contemporary society and culture. This archival exploration forms part of an education program.
As a student of history, you learn about archives. You get the impression that the archive is complete, the archive. You also get the idea of how the archive is arranged and classified, right? But in this process, from the Vault exhibition, we're actually looking at bringing these narratives, particularly to students, high school students and the university students, to come and see some of the masters that we have in these vaults, both from the University of Stellenbosch and from the University of Cote.
The exhibition is part of the Stellenbosch Triennale, themed "Tomorrow There Will Be More of Us."
When we speak about the tomorrow there'll be more of us, what do we mean? And what can we find in these archives is a way of, realizing that prophecy or that dream of tomorrow there'll be more of us. So that is why we're having the show in the museum, is that not so much about their past, not so much about their acquisition processes, but so much about what can we find that is really would help us to plan a better future, and also just to know where we're coming from as cultural producers, but also as artists in the continent.
The curator says the exhibition is an important demonstration on how art can be used to create new dialogues and show people how much we have in common despite the binaries we create in society. Yolisa Njomela for CGTN in Cape Town, South Africa.
All of the sports news coming up for you after the break, including South African Football Association postpones all games over coronavirus pandemic.
How would you create your legend? On the fields, on the tracks, in the arenas of Africa. Were you born to be a player? Could this moment be yours? Sports Scene. Find your game.
Africa Live. Find your voice.
South African sport has come to a grinding halt due to the spread of the coronavirus pandemic. The South African Football Association has now postponed all games despite the